Dr. Itazu, thank you for joining me on Voice of America live show. To start with, I just came across the news that was aired in Bangladesh that was saying that you, along with 5 other students of yours, are researching on a finding that you say the BCG vaccine that is given in most of the countries and the other part of the world, that can help reduce the mortality rate from COVID-19.
Thank you. So our study is a correlational study. COVID-19 seems to have different effects on different countries, and we wonder why would that be. So we decided to look at BCG vaccination as a possible cause. There are previous studies that have shown that BCG vaccine, although it is a vaccine that is given to protect against tuberculosis, some studies have shown that it also gives protection against other respiratory diseases. So we wonder, in particular, there were the 2 cases that we called our attention was Japan, which had was one of the first countries to be hit by the disease, and Italy. So that has been hit much harder than the disease. And as it turns out, Japan had a universal BCG vaccination policy, whereas Italy never implemented such policy.
Bangladesh has a BCG vaccine program from a long time ago, and they're hoping that the mortality rate will be lower there as per your findings. What is your take on that?
Let me emphasize this. My study is what it found is a correlation. So as we are speaking right now, in several places around the world, including Australia, Netherlands, Germany, Greece, hopefully soon in the US, there are clinical trials that are actually going to test if indeed there is a causal relationship between BCG vaccination and reduced mortality for COVID-19. My study suggests that, but it's far from being proof of that. And let me point something out that is also very important. Although there are countries in East Asia that have managed so far to bring this disease under control, and these countries do have a BCG vaccination policy in effect, let me point out that all those countries did implement quarantines, they implement broad testing and social isolation, social distancing policies. So far as I know, there's no country that has managed to control this disease just based on BCG vaccination policy. So BCG vaccination policy might give a better chance to control this disease, but by itself, it is highly unlikely that it's going to be enough to control the disease. In order to know if BCG vaccination actually does protect, we have to wait for the result of the clinical trials.
And how long would that be?
I'm not familiar with the details. I know that they are ongoing, so there should be we should start to get some results in the following months.
And what about United States? Do you think they have a BCG program?
No.
And do you think
United States, sadly, United States never, I mean, we found out that the United States never implemented universal BCG vaccination.
So we could say that one of the 4 or 5 countries that have the most mortality rates are the ones who never had a BCG vaccine program.
There's a strong correlation, but again, this is just a correlation. There might be other factors that we don't know about that might be causing this. That's why we have to wait for the result of clinical trials.
While you were researching on this, what other facts did you find out?
No, BCG is used as a vaccine to protect against tuberculosis. However, some people analyze the data and compare populations that received the vaccination versus population that did not receive the vaccination, and found that that there was a reduced mortality rate in the population that received the BCG vaccination. There are some issues with those studies, but it seems that findings seems to be holding.
So we are yet to reach to a conclusion, or as the countries like Bangladesh, they're hoping when they got this news, they were of the opinion that maybe they would see a very reduced mortality rate. So we now have to say that this is actually still on trial, and we will have to wait for the trial results to come in to come to a conclusion that it really does.
That's correct. So also the trials are going to test if the vaccine, so it's being given now to medical personnel that is being exposed to the virus, so during their work. So it's going to be also, there might be a difference between getting a vaccine, BCG vaccination pretty recent versus having get it in childhood. And there might have be some differences on the degree of protection.
So like you said, we just have to wait on the trial results to come in so as to find out what actually the vaccine does and whether it really protects people from COVID-19.
That's correct.
Dr. Itazu, thank you so much for joining us on Voice of America Bangla, and hope you are safe. As you said, you're based in New York, and the mortality rate is very high in there, and people are scared over there. Hope you're safe and you take care of yourself.
Thank you very much.